Okay, good evening, everybody. This is part 2 of How to Live to 100, a Good Hormone Health webinar, part 2 on June 7th. Turn this off for a second. On part 1, we discussed heart disease, strokes, cancer, diabetes, and osteoporosis. And I do have a retraction. I recommended HPV virus vaccination in part 1. One patient, Janet, emailed me an article that included a reference to 2012 systematic review of pre- and post-licensure trials of the HPV vaccine by researchers at the University of British Columbia, that the vaccine's effectiveness was not only overstated through the use of selective reporting and cherry-picking data, but also unproven. They concluded that further reduction of cervical cancer might be best achieved by optimizing cervical screening, which carries no risk, and targeting other factors of disease, rather than the reliance on vaccines with questionable efficacy and safety points, safety profiles. So I would say use HPV with caution, especially in your children with this new information. There was also discussion last time about, and we had several questions about, do patients with hypopituitarism have decreased mortality? I did find 2 papers. One was published by Tomlinson's group from England, Association Between Premature Mortality and Hypopituitarism, the West Midlands Prospective Hypopituitarism Study Group. And they found that patients with hypopituitarism have excess mortality, predominantly from vascular, or mainly heart disease and respiratory disease. And the age of diagnosis, female sex, and craniopharyngiomas were the most significant independent risk factors. So people that had hypopituitarism from craniopharyngiomas were younger and or females were more likely to have risk factors. And they thought that the specific endocrine axis deficiency did not seem to play a role except for untreated gonadotropin deficiency, whether that's in men or women. Another paper was published in 2006, Hypopituitarism and Mortality in Pituitary Adenoma. They took patients with pituitary surgery for non-functioning adenomas and looked at their subsequent pituitary insufficiency. And in men, there was no association. However, in women, there was increased mortality. They concluded that suboptimal hormone substitution in women may play a role. So my take on this is, as I said in the last time, that the patients with hypopituitarism do have increased mortality and most likely increased morbidity. They get sick more frequently and they have more illnesses, and some of it may have to do with suboptimal hormone substitutions. We'll pick it up with accidents. Starting off with car accidents, drive the safest car possible. Use electronic stability control and make sure you have up-to-date airbags. And Janet will like this. Avoid cell phone use, avoid texting. Make sure your tires are new and keep your car well maintained. Wear seatbelts. Don't drive defensively. Don't take risks. Avoid road rage and inciting road rage in others. Avoid bad neighborhoods. Don't confront anybody like thieves or rogues. Avoid firearms and avoid risky sports such as skydiving, scuba diving, diving, rapid river rafting, hiking alone, motorsports, or skiing. Again, some of these sports are quite enjoyable, but they are associated with some kind of risk. And if you want to lift 100, it might be best to avoid them. Home safety is crucial. Make sure you have smoke alarms, carbon monoxide detectors, fire extinguishers, safety glass. Make sure you have no loose wiring. Be careful about ladders, as I fell off a ladder in 2001. Avoid pesticides and keep your home as safe as possible. Drugs, don't smoke, definitely not. Don't use any tobacco products, including e-cigarettes and hookah. Don't drink heavily, but alcohol in moderation is okay, but don't drink and drive. And some studies have suggested that coffee is beneficial, especially in terms of diabetes. Infections are a crucial cause of mortality and morbidity. Always make sure you wash your hands. Avoid antibiotics for viruses, as that will lead to drug resistance when you get a bacterial infection. Avoid non-domesticated animals like turtles and reptiles that carry a lot of salmonella, wild birds. gets vaccinated against the influenza, the H1N1, and the pneumovax, and get treatment for pneumonia. Pneumonia has a very high mortality, especially in elderly people. People with pneumonia present with high fevers, chills, and pain on breathing. If you have any of those symptoms, go to emergency room and start on antibiotics. Dental hygiene is crucial. Poor dental hygiene has been linked to heart disease, respiratory disease, and diabetes. Infections of the gum or gingivitis allows bacteria to enter the bloodstream and leads to increased inflammation, which leads to increased heart disease and diabetes. So see your dentist regularly and brush and floss regularly. Diet is very important. Maintain desired body weight. Eat healthy with lots of fruits and vegetables, fish, chicken, lean meats, and dairy products. Avoid over-processed foods, foods with too many preservatives and additives, and ingredients that you can't pronounce. Avoid sugar, corn, high fructose corn syrup, most sweets, and a lot of simple carbs, and a lot of fried foods. Avoid saturated and trans fat. Do mindful eating. Don't do anything else while eating. Focus on your eating. Take small portions and do not have food in front of you. Try to keep healthy food around your house and avoid unhealthy food around your house. In general, I recommend weighing yourself weekly, although some people can weigh themselves daily, so that you're always mindful of your weight. But actually, it's more important to be healthy and have good physical activity are more important than the actual weight. And these studies have been shown that people that have the ability to exercise live longer than those that don't. So if you're trying to lose weight, figure out what your weaknesses are and really try to conquer them. And people say, well, I'm just going to eat this and this just tonight or this just now. The exceptions are often people's downfalls as they occur too frequently. The ability to perform cardiovascular exercise is probably more important than the actual weight. Daily exercise is best. Make it part of your day, like brushing your teeth. Sneak exercise in for even short periods of time. For example, ride your bike or walk to errands, take the stairs, do a power walk if you can. Do both aerobic and non-aerobic exercise, including stretching. Yoga and Pilates are excellent. My wife has a Pilates studio, Studio 613. So if you live in Los Angeles, I highly recommend that. Exercise helps prevent cancer, especially breast cancer, dementia, stroke, heart disease, and diabetes. And do a slow and steady increase. Have some kind of scorecard. Make sure you're tracking your exercise. It's often good to have a partner. And don't have any excuses, as the excuses will get you in. Sleep is crucial. Sleep deprivation leads to heart disease, obesity and diabetes, high cholesterol and blood pressure. People who sleep 7 to 8 hours per night is optimal, and those are the most healthy people. Those who sleep less than 5 or even less than 6 hours, 6 hours or less or 9 hours or more have a higher mortality. So avoid nighttime stimulants such as caffeine and exercise, and if it bothers you, avoid computer screens before bedtime. So let's open it up to a set of questions now. I'll put on the chat. How is the audio? Anybody have any questions? Anybody can hear me? Okay, there we go. First question comes from Kelly. Those of us who had pituitary surgery and also scuba dive have heard different things about it. Is it safe? I think it sort of depends on how far out you are from your surgery and how you're doing. It might be worth talking about that with the surgeon. I guess, somebody right out of surgery is probably not a good idea, but somebody far out is probably okay. And you ask questions by going to the chat button and just typing it in right there at the bottom here. Any other questions? Here we go. Judith is asking, she has problems with her sodium and potassium, you know, I think I have to really see what the problem is. Low sodium is a sign of too much ADH hormone. Too much sodium is a sign of diabetes insipidus. I have an article on my website that explains the sodium and water balance that you can take a look at. Potassium, too little potassium, the high potassium could be adrenal insufficiency, and low potassium can be too much aldosterone, hyperaldosteronism. Elizabeth asks, what should you do if you sleep too much due to pituitary adrenal issues or can't fall asleep till the wee hours? What helps? So I think it's a big problem. Often improper hormone replacement is due to poor sleeping. Growth hormone is needed for restorative sleep. And I did a study when I was at the NIH that a little bit of cortisol is helpful before you go to bed if you have adrenal insufficiency. For patients that are on cortisol or are sleeping poorly, I recommend like a dose of 1.25 milligrams before bedtime, which would be a quarter of a pill. Also, if people are having delayed sleep, they can't fall asleep till later and later, they should avoid computer screens and light late at night and try to get exposed to light early in the morning. Linda also has a similar question about that, since her pituitary surgery. She can't sleep due to anxiety. I find the SSRI medicines are quite helpful for both anxiety, depression, and sleep, like Zoloft, and I possibly would consider using that. Growth hormone often helps with the sort of like you're lying in bed anxious. So if you're not on growth hormone, that would be another indication for growth hormone. Is sleeping too much due to too much or too little cortisol? It could be both. It could be neither. In general, most of my patients with Cushing sleep too little. They're wired at night and they sleep during the day. And patients also with adrenal insufficiency don't get into deep sleep unless they, as I said in my study, take a little bit of cortisol the night before. So in general, I think both high and low cortisol usually give you too little sleep. Too much sleep, you know, just maybe you're not getting restorative sleep, you're not sleeping well. Some of the medicines might play a role in that. Is there a good way to modify resistance training to make it more effective? I would say just do it more gradually. I think if I had a choice, I would push more aerobic exercise than resistance exercise, but they work complementary. And I think in general, you want to increase your reps, do more of them, do them longer. I don't think, especially for women, you want to increase your weights particularly. You just want to do it more. You know, I think in terms of what you're actually doing, it might be worth meeting with a trainer to see if there's ways to optimize it. Linda asked that her days and nights are mixed up as well. So again, it's a common problem with patients with pituitary problems. Some of this may be their circadian rhythm is off. Growth hormone helps. Again, exposing light to light early in the morning and not late at night helps. So a little bit of cortisol at night can help, and a gradual trying to move your circadian rhythm to more normalized pattern is helpful. Linda also asked about oxytocin. I have started giving some oxytocin out to some patients. Many of them do find it helpful, and it does seem to help somewhat with sleep and anxiety, but this is certainly a non-FDA approved indication, and I'm just starting this on some of the patients. And Judith asked about high blood pressure, high top number, and low bottom number. In general, I'm usually more concerned with the top number, so I probably would treat it with the antidepressant. Is caffeine good? Are caffeine pills good too? So I would say caffeine is helpful statistically for people that drink caffeine have less diabetes. The problem with caffeine is it affects your sleep, and you're going from on caffeine to off caffeine, a lot of times people, after the caffeine wears off, they feel really tired. So I'm not sure it's good. I think it's just good in terms of preventing diabetes, but you have to sort of, and I don't tell people to stop caffeine. I just tell them to sort of regulate it. People like their morning coffee. I think that's quite good. But I don't think caffeine pills are really that helpful. I'd probably, if somebody has something that's related to poor focus and fatigue, and I would probably use something like Ritalin or another stimulant more than caffeine pills. Judith asks, she's too tired often to exercise. You got to start a little bit, you know, start doing some stretches, go on a simple walk, and just try to gradually build it up. And then I think, again, you need to have your hormones optimized. Linda asked, so Judith asked a question about antidepressant for anxiety and blood pressure, even though she's not depressed. The SSRI drugs are very good for anxiety and helpful for sleep. I didn't mention them for blood pressure, but the SSRIs are good for anxiety and sleep, even if there's not much depression. Linda asked about, I have a very odd symptom since pituitary surgery, whether it's anxiety related or not, terrible sensitivity to noise. My brain cannot filter out background noise either, noise hurts. I'm not sure what that is caused by. I don't think it's endocrine related. It might be some kind of neurological problem. And if people have a choice, I think you can send your questions to everyone. I think then everybody can see it easier. So let's go on with the talk here. We'll get some more questions in a couple more minutes. Go to sleep around the same time each night. Wind down before going to bed. If you fall asleep too late, get morning light and avoid afternoon and evening light. If you fall asleep too early, avoid morning light and get afternoon light. I would say the best drug is melatonin, and the dose varies. Some people like 0.5 milligrams, some people like 3 milligrams, and usually want to try different doses. It's quite safe, and it usually works pretty well and has very little side effects. Okay, next I'm going to talk about a controversial area that I think I disagree with a lot of other providers, but this is my thoughts. So, nutritional supplements are a multi-million or billion-dollar enterprise. They're not regulated by the FDA. They do not have to be shown to be beneficial, unlike medicines. The only rules for nutritional supplements are they cannot be dangerous. You can't make false claims. So they can't say they help cure diabetes. They can say they may help decrease diabetes. Many providers use a lot of them. I'm not really that big of a fan. I think most of the data and literature is quite unimpressive on them. I would say it's better to eat your food, your vitamins in your food, rather than in your purse with a bunch of supplements. And there's really little published articles on benefits. Some healthcare providers order less than scientific tests. For example, they use urine testing for neurotransmitters. I don't think there's any relation between the neurotransmitters in your brain and what comes out in your urines. They then sell you supplemental packages based on these results. And many of my patients have pocketbooks full of supplements costing thousands of dollars per month. And I always wonder, if each one works so well, why do you have to take so many? I'm fairly skeptical, but for the most part, I don't take people off them if they feel they're helpful and working, unless they're harmful or affect some of the other hormones I use. I always recommend people to do a trial of at the end of one, that if something may be good, just try that one and see if it helps you. If it doesn't help you, probably stop it. My general approach as an endocrinologist is to look for early signs of a hormone or vitamin deficiency via blood tests, replace the deficiencies until achieving mid-normal range, and don't treat if not deficient, and look at the risks and benefits of treating. So in terms of vitamins, eat food with natural vitamins rather than supplements. Eat a wide variety of foods, especially fruits and vegetables. Different colors is often good. The reds, yellows, oranges, purples, greens, all those vegetables have different types of micronutrients that are helpful. I would say a multivitamin is reasonable. Now, this is also a little bit controversial. Calcium supplementation has shown only marginal effects on bone density, and recent studies have suggested it may lead to heart disease. And there's no effects on reducing fracture. So I think calcium supplementation is going out of favor and will continue to go out of favor. It's better to eat foods high in calcium. There are some indications for calcium, but I think to put everybody on it probably doesn't make too much sense. Eat foods with nutrients, antioxidants, and vitamins. Don't eat the isolated nutrient, antioxidant, or vitamins. Healthy foods have other not yet identified nutrients. Studies of using antioxidants and vitamin E, vitamin C, and E, beta-carotene have been disappointed. But vegetables, such as orange vegetables, have a lot of, like sweet potatoes and carrots, have a lot of beta-carotene, which is helpful. Green leafy vegetables is excellent, and tomatoes have lycopenes, which is also quite helpful if they're in the tomato. I would say one of the hormones that I am a fan of, I know, but with somewhat limited certainly data on it, is vitamin D. Vitamin D is an important hormone obtained by either being in the sun or drinking milk. There's a clear genetic component to that. Some people can be out in the sun a lot, eat a lot of vitamin D, and their vitamin D levels tank. Other people don't seem to need much of it, and I think it has to do with how you metabolize it and your binding proteins to it. Deficiencies in this is, many people, including myself, use a level of 30 nanograms per mil as a deficiency, and it's quite common. I want to stress that vitamin D deficiency is associated with osteoporosis, diabetes, cancer, high blood pressure, and heart disease. There's been no study showing that it causes any of the disease or that replaces or reverses any of these diseases. However, the patients that have low vitamin D have more of these diseases. I did a very large and well-designed study giving vitamin D to patients with prediabetes, and we took patients that had low vitamin D levels, gave them a lot of vitamin D for a year. We looked very carefully for the progression from prediabetes to diabetes. We looked at various markers of insulin resistance and insulin secretion, and we did not find any beneficial effects of vitamin D compared to placebo. So this is one of the few prospective studies, but it did show no effects. There's also ideas that vitamin D may help with infections, tuberculosis, development of heart disease, and development of cancer. So I would still recommend optimizing your levels, even though the causality has not been proven. I would measure your 25-hydroxy vitamin D level in your blood. If it's less than 30, it should be replaced. Target level is 30 to 40. However, if people have a history of breast cancer, I might push it up to 50. Above 50 is associated with higher morbidity and mortality. Many other providers recommend much higher levels, but the studies have all shown that 30 to 40 is the optimal target level. Above that and below that, there's higher morbidity and mortality, certainly above 50. So I don't know how these doctors get their recommendations to go to levels of about 80, but if you look, at all the literature, it all says between 30 and 40 is optimal. Lifestyle is crucial. Avoid stress, be optimistic, avoid confrontation. That's been shown to increase lifespan, have a happy marriage, have a good balance between work and leisure. People work too hard and don't work hard enough, have higher rates of mortality and live less. Avoid not working. Try not to go on disability if you can. Avoid early retirements if possible. Obviously, if you're quite sick, there's no choice, but in general, most people do better if they keep on working. Be active in your health care. Try to take control of your health. Be part of the community. People that have that are part of a community live longer, and people that go to church or synagogues also live longer. And if you want more information or to schedule an appointment, you can go to goodhormonehealth.com, and we'll take some more questions now. I think I probably have a lot of questions here. So Elizabeth says, does Cushing's syndrome damage quadriceps permanently? I felt I could not get up from the ground for 90 minutes. Is there hope for gaining quadriceps strength back? I cannot build muscle. So definitely patients with Cushing's have decreased muscle strength. Most of it is reversible with surgery and a cure from surgery. I would also recommend glutamine replacement. Glutamine is an amino acid that helps with muscle strength. It's available in health food stores. 15 grams twice a day is a good dose, and a lot of people find that that's helpful for muscle strength. Adina asked about trying SSRIs and became more anxious. From my research, even though it's an oxymoron, it's a common effect. Yes, so antidepressants do have a lot of side effects, including making me feel more depressed and more anxious. And again, side effects are common. It might be worth trying a different SSRI. If you try 2 or 3 and they still don't work, then it's probably you probably have to try a different type of drug. Do some people find cortisol affects their moods, makes them jittery and moody? Absolutely. So cortisol is a crucial hormone that can affect people's mood. Many people actually feel better when they take cortisol. People have explained to me they've got cortisol for a sinus infection or for bronchitis, and they felt really good. But that doesn't mean you have low cortisol. Cortisol in general makes people feel good. And you know, sometimes patients with too much cortisol, like Cushing's disease, feels moody, anxious, irritable. Mood swings are quite common. Linda asked, does pituitary affect histamine levels? I don't think so. I haven't heard about that. Is there any connection between increased chemical and increased allergies since surgery? I also haven't seen any connection with that particularly. Patients that are adrenally insufficient, I was involved in a paper many years ago, are more likely to have multiple chemical sensitivity syndrome than people that don't. Adina asked for vitamin deficiency. Is the pharmacy brand good enough, or do you need to buy from more expensive companies like Life Extension? I would say to start with a pharmacy brand is pretty good. If you don't tolerate that well or having a side effect, I think it might be reasonable to try something more expensive than Life Extension. Generally, I think Life Extension has excellent products, but whether you need to or not, if you just have a pharmacy brand, I think is probably to start with a pharmacy brand. Judith asked about hair growing back on your scalp. In general, optimization of hormones can lead to better hair growth, and that would include making sure your testosterone is not too high, making sure your estrogen is good, making sure your ferritin is good, and making sure your thyroid is good. How do we translate milligrams to units? Most of the time in vitamin D, we talk about units. I think it's you divide by a quarter to go from milligrams to units, but I can check that and let Adina know. Are any studies coming up with growth hormone on older patients? I'm 66, and they won't let me take it much longer. I'm currently on low doses. I think growth hormone is okay at any age as long as you watch your IGF-1. So if your IGF-1 is in the normal or upper normal range, I don't see any reason to stop it, especially if you're doing well on it. What I think about glutamine injections, that I'm not familiar with. I just use glutamine powder, and I think that works pretty well. Elizabeth asked, does Cushing's affect vitamin absorption, and what can we do to optimize that? Should we take some vitamins in liquid form? So I don't think Cushing's per se affects absorption. I think adrenal insufficiency does more likely. So the cortisol is very involved in gastric motility. A lot of my patients, one of the first things they manifested with adrenal insufficiency is abdominal pain, diarrhea, and poor absorption. So those patients, sometimes they need to be on IV medicines, for example, or liquid medicines. In terms of Cushing's, I haven't seen anything. In terms of iron, taking vitamin C helps with the absorption. Some things may be absorbed better in liquid form than in pill form. And some of the things may be better to take by the skin or by nasal spray, for example, if they're not being absorbed. Kelly asked, with poor appetite and nauseousness, What is the best thing to do regarding meals? I usually have a great diet, but when I don't want to eat, it's not good. It's better to eat something and add a multivitamin. Yes, I think people should always eat. I think if you skip meals, it's not good for your health, and you'll feel lousy coming up later. So I would try to eat a little bit. If some people have this nauseousness, especially with adrenal insufficiency, try to drink some liquids. Take something that helps treat nauseousness, like Zofran, and try to take something down. Adina asks, is exogenous Cushing's reversible? I would say yes. Patients that are on high doses of cortisol, it does cause adrenal insufficiency. Their own adrenals will stop working, but often with slow tapering, their adrenals will start waking up, and they can go on to making some cortisol themselves. Sort of depends on how long they've had the exogenous Cushing's and what doses they're on. Janet says she's taking 100 milligrams Cortex a day because of crisis and pneumonia. Should I split the dose or take it all in the morning? I would split the dose. I would probably take 60 in the morning, 20 in the afternoon, and 20 in the evening, and gradually taper down. Adina says immune deficiency caused by illness causes mast cell activation, which leads to more allergies. That sounds reasonable. I'm not sure I'm an expert on that, but I think that is reasonable. Linda asks about bioidentical hormones. Do you feel there's any value to saliva testing for hormone deficiency? For the most part, no. The saliva tests that are commercially available to patients, like ZRT, are usually very unreliable. They have both non-reproducibility and non-accuracy. So I generally test more in terms of blood levels. In terms of bioidentical versus synthetic, which is better, I would like to use hormones that are as close to replicating what I would normally produce. So I think this concept about bioidentical hormones is a little misunderstood, but I think it makes sense. So I think it makes sense is what Linda is saying. She wants to use what the body normally produces. So the body normally produces estradiol. So I would recommend estradiol replacement in terms of her estrogen replacement. We used to give a medicine called Premarin, which came from pregnant mare urine, which is very synthetic and very non-bioidentical. However, some of the compounded bioidentical hormones include E1 and E3. The E3 is quite inactive, and the E1 may even contribute to breast cancer. So I think the main thing is to stick with what the body makes. And for example, Prometrium is natural progesterone, as what the body makes is maybe more bioidentical than Provera. But I think people can go overboard on this and also maybe misunderstood it. Not all the hormones have to be made from yams. Linda also says she reacts easily to everything and sensitive to drugs, so I think it's important to take things in low doses, start low, and if you have a side effect, stop it and go on to discuss with your doctor and consider something else. Adina also asks, why do we need to stay in the lab range for age if an older person wants to feel as strong as a young person? Because an older person is not a young person, and the body is different, and the ages is what's normal for somebody that age. In general, that might be a difference between an endocrinologist and an anti-aging doctor. An endocrinologist wants to keep the level in the range for that age, and somebody that has a decline in hormones, we want them to still be appropriate for their age. Anti-aging doctors like to replace people to super physiologic levels, and they usually have side effects from that, or can have side effects from that. Elizabeth asks, how common is it for pituitary scar tissue from surgery to eventually cause the pituitary to stop working? Cause permanent need for cortisol replacement, how many years after surgery does this occur? I don't think scar tissue causes it. I think that at the time of surgery, the pituitary can be damaged, and that damage can lead to hormones not working downstream. Sometimes it happens immediately, sometimes it can take years for it to occur, and sometimes other hormones that people are taking can cause the hormones to not working. Judith asked that she's 66 on no hormones, whatever. She's on thyroid and cortisol and growth hormones, so she is on hormones. I think her question is, do she need estrogen and progesterone hormones at 66? So I would say in general, I like to give estrogen and progesterone replacement until women are around 60. There was the most famous study called Women's Health Initiative. It took women in the most part in their 60s and gave them estrogen and progesterone, and those people had higher rates of heart disease and blood clots and strokes. When they did sub-analysis, the patients that were around menopause in their early 50s and late 40s actually did better and had lower rates of heart disease, strokes, and blood clots. And I think people should, when they go into menopause around 50, natural menopause around 50, then they have a lot of symptoms, and as the years go by, they have less symptoms. So at least I readdress people's estrogen replacement when they're 60. Somebody who's 66, I probably would not start estrogen and progesterone. And somebody, we had talked about this the last time, who has panhypopituitarism, you know, I would say I would replace them probably again until they're about 60, and then think about tapering them off around 60, although, you know, sometimes we could do it earlier or later. Okay, so Adina asked about why are the lab ranges important for all of us? Maybe the ranges aren't relevant. So the way the range works is they take 100 or 20 or so people that are healthy, don't have a disease, don't have any diseases. They're often people that work at these at the labs, and measure their hormone usually at 8 in the morning, and determine what the middle 95th percentile of them is. The highest 2.5 is cut out, the lowest 2.5, and the rest makes the range. So you look, for example, at the IGF-1 range, it's a little bit all over the place. It doesn't seem to follow that much of a pattern, but it's still how the lab gets it. And you want to be in that range. You don't want to be somebody in the top 2.5% or the bottom 2.5%. So I usually do replace people to somewhere in the range of these hormones. And I would say, one of the cautions is to make sure, first of all, that people are healthy, which is, for example, a problem with thyroid disease. A lot of people have hypothyroidism. They may be included in some of these ranges. So some of the better, newer ranges takes people, looks at their TPO antibody, and excludes people that have a positive TPO antibody, and then you can get a true, quote, normal range. Is there any medication, antidepressants, sleeping meds that can affect our hormones, cortisol, prolactin, et cetera? Yes, all of them can, and that's why it's very important to be followed by an endocrinologist and be carefully monitored when you're taking medicines. The SSRIs probably raise a little bit your ACTH. Sleeping medicines, Xanax and things like that, lower cortisol and ACTH. SSRIs raise prolactin levels. Most antidepressants raise your prolactin level some. Cortisol can lower your thyroid, for example. So definitely balancing people's hormones, especially hypopituitary patients' hormones, is a definite art that needs to be done continuously, and patients should be closely followed. Beth asked about, she has a meningioma, should be concerned about taking growth hormone. I think this is a controversial area also. I would say if the meningioma is quite stable and small, and it's been followed for many years and isn't growing, I think the growth hormone is okay. If it's a newly diagnosed meningioma, I would probably hold off on growth hormone until you can see if it's stable. Kelly asked, you're talking about a natural decline in hormones. Is the same level equivalent for different ages? I would say if somebody had a level as appropriate for an individual that's 20 years younger or too high for their age, wouldn't it impact differently if they were 20 years younger? Yes, of course. So that's the whole point, is you want to try to curtail the levels to somebody's appropriate age. So somebody who's 20 has like a higher estrogen level than somebody who's 60, and with their growth hormone, et cetera. So you do want to taper something, adjust somebody's hormones to their age as well as their symptoms. Linda asked, since losing part of my gland to surgery, why does my body no longer handle stress properly? It seems like my nervous system does not handle stress at all. So definitely hormones play a crucial role in handling stress, especially cortisol. Does the pituitary control our flight or flight response? Yes, definitely. Again, it controls cortisol and sort of indirectly controls epinephrine. How can I improve this? Well, one thing is to try to minimize the stress. Second thing is to make sure your hormones are properly replaced. And make sure you're on the right medicines. Adina asks, how would my body know that I'm 100 if I keep all my hormones at a young age? Because your body's more than hormones. There's a whole bunch of other things called telomerases that change with age. Your cells in your body have clocks on them that know how old they are, and it's not just hormones. Interesting question, though. Do you replace testosterone in women over 60 after stopping estrogen and progesterone? I would say yes, I do. That really the estrogen and progesterone in this Women's Health Initiative study haven't shown to give increased clots, strokes, and breast cancer. The testosterone, although it hasn't been studied, certainly hasn't been studied in that many patients, has not been found to do that. So I think I would, in general, I do keep people on testosterone, but I might give them a little lower dose as they go over 60 while stopping the estrogen and progesterone. What does my doctor need to know before giving me an antidepressant when I'm not depressed, just anxiety and blood pressure issues? I think your doctor needs to evaluate your symptoms and your hormones, and you might try, you can be on a trial of an antidepressant and see if it works. If it doesn't work, you can probably stop it. What are very large pupils indicator of our health? I think you want to make sure the pupils constrict properly. If they don't, it could be a neurological problem, but I don't think actual pupil size means that much. At least I'm not familiar with it. When having stim tests, I always ask the endo if I can take my sleeping medicine the night before. They've indicated there's no problem will not might affect my stim test. Is this right? I think the night before is probably enough time that it'll wear off in the morning. And the stim tests in general give high doses of either glucagon or cosyntropin that will sort of override some of the effects of medicine. So I think we usually do allow people to take their medicines the night before. Does high cortisol suppress TSH? Yes, it does. And does this mean we need more thyroid hormone because cortisol is making TSH a little lower than it is? No. I think you want to look at the T4 and T3, not the TSH. T4 and T3 are the active hormones, and they can also go down with cortisol. And patients with Cushing's often have what's called central hypothyroidism, where they have low T4, T3, and TSH. If that's the case, then you have to adjust the T4 and T3. Adina asks, what do you think about melanocyte-stimulating hormone? Melanocyte-stimulating hormone is made in the pituitary. However, it's made also in the brain, and the role in the brain seems to be much more important. The role in the brain seems to be related to food intake, while the role in the pituitary seems possibly related to skin pigmentation, and that's about it as far as I know. So by measuring what's in the blood and giving it back, if anybody's able to do that, I don't think it really affects what happens inside the brain, inside those areas related to food intake. Kelly asked, keeping hormones at an age of somebody younger could result in increasing cancer, among other things. I think it depends on the hormone. So, for example, growth hormone can promote cancer. And in growth hormone, if you give somebody a high IGF-1 for their age, but it might be normal for a young person, that's been associated with increased rates of cancer. Somebody's thyroid, in general, TSH rises with age. Many people can have a high TSH that are elderly and not have hypothyroidism. So you want to take that into account when you're interpreting somebody's thyroid function test, for example, and not put people on inappropriate doses. In terms of testosterone, for example, the testosterone does decline with age, but it doesn't decline a huge amount. I think the decline is a little bit overstated. But, I would probably still try to replace somebody the appropriate dose for their age. Adina asked, which hormone do you think is next to be studied and replaced after oxytocin? That's a good question. I'm not really sure. I think the ones we are replacing are probably the key ones. Maybe beta endorphin might be one that's made by the pituitary that we might want to look at. Linda asked, have you found that oxytocin has helped with anxiety and includes OCD symptoms? I've only started giving oxytocin to a small number of patients. None of the patients I've given it to has handed me back a survey after being on oxytocin, and I am going to start asking the patients that are on it to try to give me back the survey, both the pre and post. If anybody's on this chat and webinar that can do a survey and another urine test after being on it in 3 months, I think I would get a better idea of what has actually helped if when we get the surveys back. Many people started the oxytocin, like in February, March, and April, so it's starting to become time for them to 3 months, 3 months time. So I would like to see that, and then we can, I'll learn more about it once I get those back. Adina says she had an infusion. She got 50 milligrams of polycarpinate before they said it's standard. Does she need it? I think I would talk to maybe ask the doctor. My patients in California that get infusions, they don't get anything before. I'm not sure if that's a function of that one doctor. You might want to check with another hematologist. Elizabeth asked, how does one do an oxytocin test? It's a 24-hour urine test, and I only do it for the patients that I am seeing, but I'm happy to see Elizabeth. Adina said she sent me the survey 3 times. I'm sorry, I guess I have one patient that sent me the survey, but I still want to see her oxytocin levels in her urine before and after it. Judith also asked about getting oxytocin testing. I do only do that for the patients that I am seeing. Linda asked, since her surgery, I've noticed heart palpitations that are strong and occur every day. I'm only on DBAVK, no other hormone, and have 50% of my gland left. So general palpitations can be due to anemia, so I would make sure your ferritin's okay, and taking iron. Palpitations can be due to overactive thyroid. You want to make sure your thyroid is okay. And palpitations are, I don't know if they're caused by low magnesium. That magnesium is often very helpful for it. And dehydration, low aldosterone can also give you palpitations, so you want to make sure your blood pressure is okay. And if you need to take more salt, that might help you. It's worse when she goes upstairs. That would indicate maybe some volume depletion, and that would help with taking more salt and getting her blood pressure up and more fluids. Kelly asked, I've been able to exercise to level health benefits, but I cannot get up to the point of fitness benefits now. I can do small baths that add up to an hour. Is it better to just go with it or keep trying to figure out how to increase my time to 20 minutes? Just every day, try to do a little bit more. I think what you're doing sounds great. And just try every day. You can add another minute or so and see how you can do it. Janet asked me about going into crisis and stopping the oxytocin. Doesn't make any sense to test. I think I would only test while you're, I mean, you already tested off, but I would test while you're on it at a stable level. I don't think it makes sense to test it now. But, if you want to test it, presumably you haven't stopped it too long, you might be able to test it, but maybe wait till you're more stable. Dina says low magnesium causes low PTH. I have heard that before, and can give low calcium, so somebody with low calcium should have their magnesium replaced. Linda asked, when in relation to waking, everything goes to my stomach and chest. Is this common from pituitary damage? Most of my patients with hypopituitarism have central obesity. It could be growth hormone deficiency mediated, I think. Too much cortisol usually gives weight in their abdomen and central areas. And, there might be people also have, some predisposition to this. You have apples and pears. And I would say more of my hypopit patients are apples, but there's some people that change from a pear to an apple. Adina asks, is it possible for hypopituitarism patients to live a normal life? I would say yes. I think with the proper replacement, people with hypopituitarism can do quite well. Adina asks about beta morphine. It's beta endorphin, and right now we can't replace it, but that's something I think in the future we can try to look at. Elizabeth asks, she can only do 2.5 minutes of an exercise video, but tries to do every day. My body refuses to let me because my arms and legs feel too heavy. What might cause that? I would probably do walking to start with and try to do like a stretching, Pilates, and yoga, and try to gradually increase with that. You also might try the glutamine. That may help you, and trying to make sure all your hormones are optimized. Linda asks, I have to take Advil for pain management several days per month. Does that have any issues with DBAVP and DI? I don't think so. Too much Advil can certainly affect your kidneys, but I think small amounts are okay. We'll have time for maybe 2 more final questions. Which is better, Tylenol or Advil? Probably Tylenol has less side effects, and it's probably safer to take. Tylenol can give you liver problems if taken too much. Advil can give you kidney problems if taken too much, and stomach problems. So, you just see how you do on them, and probably maybe try to trade off between them. Adina asks, can the body get used to DBAVP? I don't think it gets used to it. I think people need maybe different amounts depending on the cortisol levels. Cortisol plays a big role in how the body handles DBAVP. You take one medicine, you have to, oxytocin will probably play a big role in DBAVP, so you start to have to adjust it. Judith, I'll send you the, I think I'm pretty sure I have your email. I'll send you that sodium article. Dr. Linda asked, I have central waking. I worry I have cyclical Cushing's, high unlikely, but it's a worry. If you have a stimulant and you have Cushing's, would that just be an indication you don't have Cushing's? I'm not sure exactly what you means, but maybe she means that if you have a stimulation test and have adrenal insufficiency, would that be an indication you don't have Cushing's? Some of my patients can have cyclical Cushing's. They have highs and lows. They can fluctuate between adrenal insufficiency and Cushing's. The best thing is to try to test when you're in a high. Okay, so we'll call it a night tonight. I think everybody, I enjoyed the chat. I hope everybody learned a lot, and we'll have another chat coming up soon. Thanks.